I want to take us back to basics. So taking a few steps back, just in case people aren't convinced that if there aren't people out there who aren't convinced that this is an issue or mental wellness or mental health isn't an issue in the workplace, could you share with us what is mental health?
Uh-huh. So mental health is the state, right? Achieving a state of mental health and wellness is a state in which an individual's capacity to positively engage in the world and flourish is optimized, right? So mental health is a lot more than the absence of mental illness, right? So mental illness is a state of living with recognized, identified symptoms that impair an individual's emotional, cognitive, interpersonal functioning. But getting to a state of mental health is more than the absence of those symptoms. It's taking us beyond to a state of psychological engagement, cognitive capacity, and an experience of flourishing.
And I think we can deduce from that what it might look like if we don't feel that at work, that if we don't feel like we're flourishing. And this is where I think some of the work that we do at Kotter, this whole notion of wellness and health connects to Thrive and how we show up to work every single day. Do we feel like we're in a state of flourishing and being able to work in the workspace, feeling optimal? Or do we feel like we're constantly burdened with this stress or feelings of burnout where we just need to go take a break?
Right. That's absolutely right. And so, for example, I think you've hit the nail on the head, Maria, in terms of the dynamic of what's happening now with what's called quiet quitting, right? Workers are coming in and saying, I've been here for 30 years, right? I've been here for 20 years, and I haven't had the opportunity to, my salary doesn't barely supports a living wage. And I'm being asked to do twice as much as I did 5 years ago. And our department used to be 20 people and now it's 5. And we've taken on 3 other priorities for the organization. And people are saying, we're not doing this. And the burden on the workers is a tax psychologically, physically, emotionally, spiritually, in terms of feeling like I matter in this place or that people care about me in this place. And if you've got a workforce that is in that state, they may not have a mental illness, but they don't have a state of mental health. They're not going to feel like they're thriving and flourishing. You're absolutely right.
Out of curiosity, I'm thinking a lot about sort of the individual experience in relation to the collective experience. So I've heard the metaphor a number of times over the past couple of years around, we started by saying we're all in this together, we're all in the same boat. We're not all in the same boat. We're in our own individual kayaks, navigating through the same ocean, right? And that was a metaphor that when I heard it really resonated with me. As we have this conversation about individual mental health, and then you look at mental health in the workplace and we think about our collective mental health, is there a frame that is organizational mental health, and how much of our experience is collective and how much of it is individual, and how do we need to be thinking about that as leaders in organizations?
So I'm going to share my belief on this. I don't know that I could tell you that I have science on this, but I do believe that there is such a thing as a healthy organization and an unhealthy organization. And that in my view, one of the real challenges for organizations today is that the healthy organizations are going to do some really difficult reckoning. And the reckoning is that we have lived through a time of ever accelerating focus on productivity and return on investment only measured by the dollars generated. And in my view, that's a very anemic measure of success, of productivity, of return on investment. And so I think we're going to see over time, and we are seeing organizations that are truly integrating other metrics to measure success. And that they are not just the cherry on top that you can have or not have, but actually integrated into performance indicators, integrated into measures of success are other qualities around that reflect an organizational values and priorities. And I think we'll see a diversity of solutions in that regard. It's certainly part of the B Corp movement. It's certainly part of the ESG movement to say, listen, organizations that are businesses need to be able to economically sustain and grow and be productive, but the story's bigger than that. And we are now in a place where we can actually imagine other aspects to measuring outcome and success that include enhanced and integrated metrics. And I think a piece of that needs to be around human capital and mental health. And when these metrics are integrated and are part of the core values of an organization, then you don't suspend them in hard times, right? You live them in good times and bad. So that's the reckoning that I think is the opportunity for organizations today.
Mhm.
Can
And
you
what
talk a
I'm
little
hearing-
bit?
This is so interesting. So many things that you're saying. Go ahead, Rachel. I just wanted to jump in and ask another question, but go ahead.
I was just going to go down that same line of questioning more into that measurement and metrics topic, because you've mentioned more comprehensive approaches to how we measure our success. And you also have talked about the mental health in the workplace, or mental health at work index. And I think I may be right or wrong. Again, this is not a scientific or data-based assumption, but my sense is that there is a skepticism culturally that mental health in the workplace is even measurable. And so I'd like to know from you, I'd like to just learn a little bit more about the index, about how you're thinking about measuring mental health in the workplace, and just what we can all be understanding about what's possible through
Mhm.
measuring that, and what sort of the benefits of just assessing it and having that data in our pockets could be.
So there are several facets to measurement. There is no question that we can measure mental health and psychological well-being. And the plethora of employee surveys today around mental health, psychological well-being, flourishing, there are many, many, many different variations on a theme in that regard. And the data are consistent and reliable in terms of individuals being able to tell, being able to report on their mental health and psychological well-being. There's no question. Is there a single definition or a single instrument? No, but there are standardized assessments that organizations can use to look at their employee mental health, psychological well-being, thriving, and symptom checklists that are very consistent, very standard. So I don't think there's a whole lot of debate around that. People could debate which instrument they prefer, which one seems more culturally attuned to their workforce or where they operate, but that's measurable. What hasn't been measured is what organizations are doing and what matters in terms of organizational leadership, what matters in terms of organizational workplace design and environment, what matters in terms of training, what matters in terms of resources and benefits. Those are the things that organizational leaders actually have control over, right? Their workforce mental health is impacted by work, but their workforce mental health is impacted by a whole lot of other things also. And so we think of the workforce reports in terms of their mental health as being more of an outcome metric, more of an outcome data point. And organizational leaders, when they find out, okay, we do a survey and we find out that 3/4 of our workforce reports feeling very much or too much stress more than half of the work week, right? Something like that. And it's having an impact on sleep and energy, concentration, mood, right? Those things we can measure and we can say that's not good. But that doesn't tell the organizational leader what they should do about it, right? What we need to do is roll it back one layer now and say, okay, so you as an organization, what can you do about the fact that you've got workers, employees who are in this state of not flourishing? And help organizations measure what they're doing, what their programs and services are, what their leadership is doing, what is their mental health strategy? Is it integrated in their organization? Is it part of their management review? Is it part of their dashboard that goes up to their governance board? Like, where does it fit in? And those things are going to make a difference in terms of what the organization is doing and how the organization is structured, that will then create the environmental factors that will optimize the opportunity for the majority of workers and employees to actually feel much less stressed and to psychologically, emotionally feel a much greater sense of flourishing. And for those who, even in those optimized, a more optimized environment, continue to have mental health symptoms, actually create an organizational culture where they can get the additional supports they need.